Question 1. A client with a history of heart failure is admitted with acute respiratory distress. The nurse notes crackles in the lung bases, jugular venous distension, and a productive cough with pink, frothy sputum. Which intervention should the nurse prioritize? A. Administering a prescribed oral diuretic. B. Placing the client in a high Fowler's position. C. Obtaining a 12-lead electrocardiogram, ECG. D. Preparing for central venous pressure monitoring. Answer. B. Placing the client in a high Fowler's position. This question tests prioritization in acute respiratory distress, with key clues being acute respiratory distress and pink frothy sputum, indicating severe pulmonary edema. Placing the client in a high Fowler's position immediately reduces venous return to the heart, decreasing pulmonary congestion and improving lung expansion, which directly addresses the life-threatening respiratory symptoms. While other interventions like diuretics and ECG are important, maintaining adequate oxygenation and ventilation is the immediate priority. Remember, always prioritize ABCs: airway, breathing, circulation. In acute situations, to stabilize the client first. Question 2. The nurse is caring for a client with type 1 diabetes mellitus who is scheduled for surgery. The client reports feeling dizzy and lightheaded. The glucometer reading is 58 milligrams per dl, 2 mol per L. What is the nurse's priority action? A. Administering 10 units of regular insulin subcutaneously. B. Providing 15 grams of a fast-acting carbohydrate. C. Preparing to administer intravenous dextrose 50%. D. Notifying the healthcare provider immediately. Answer. B. Providing 15 grams of a fast-acting carbohydrate. This question focuses on the immediate management of hypoglycemia in a conscious client. The key clues are the symptoms of dizziness and lightheadedness, combined with a blood glucose reading of 58 milligrams per dl, 2 mol per L, which confirms hypoglycemia. For conscious clients experiencing mild to moderate hypoglycemia, the priority is to provide 15 grams of a fast-acting carbohydrate orally, such as 4 ounces of fruit juice or regular soda, to quickly raise blood glucose levels. Intravenous dextrose is reserved for severe hypoglycemia or unconscious clients, while insulin would worsen the condition. When blood sugar drops, act fast with a quick sugar source. Question 3. A client is receiving total parenteral nutrition, TPN. At home, the client calls the clinic reporting headache, nausea, and an elevated temperature of 101, 8 degrees Fahrenheit, 38, 8 C. The nurse observes erythema and swelling at the catheter insertion site. What is the most appropriate nursing action? A. Slowing down the TPN infusion rate. B. Administering a prescribed antipyretic. C. Immediately notifying the healthcare provider. D. Changing the TPN solution and tubing. Answer. C. Immediately notifying the healthcare provider. This question assesses the nurse's ability to recognize and respond to potential complications of TPN, specifically catheter-related bloodstream infection, CRBSI. The keywords headache, nausea, elevated temperature, erythema, and swelling at the catheter insertion site are classic signs of infection. The most appropriate initial action is to immediately notify the healthcare provider, as this is a serious complication requiring prompt medical evaluation, blood cultures, and potential antibiotic therapy or catheter removal. While antipyretics might relieve symptoms, they don't address the root cause, and slowing the infusion or changing tubing without orders delays definitive treatment for a potentially life-threatening infection. Always remember that signs of infection with a central line warrant urgent medical consultation. Question 4. A client with a deep vein thrombosis, DVT, is prescribed unfractionated heparin. The nurse reviews the client's laboratory results and notes an activated partial thromboplastin time, APTT, of 120 seconds, therapeutic range, 60-80 seconds, What is the nurse's priority action? A. Administering the next scheduled dose of heparin. B. Holding the heparin infusion and notifying the healthcare provider. C. Increasing the heparin infusion rate as per protocol. D. Preparing to administer protamine sulfate. Answer B. Holding the heparin infusion and notifying the healthcare provider. This question tests the nurse's understanding of heparin therapy and the significance of laboratory values in managing anticoagulant medications. An APTT of 120 seconds is significantly above the therapeutic range of 60-80 seconds, indicating an increased risk of bleeding. The priority action is to immediately hold the heparin infusion to prevent further anticoagulation and notify the healthcare provider for further orders, which may include a dosage adjustment or administration of an antidote like protamine sulfate. Continuing the infusion or increasing the rate would dangerously elevate the bleeding risk. If a client's lab values show too much anticoagulation, stopping the medication is key to preventing harm. Question 5. The nurse is caring for a 4-year-old child admitted with acute glomerulonephritis. The child's urine output has decreased significantly, and the blood pressure is elevated. The nurse observes periorbital edema and lethargy. Which dietary restriction is most critical for this child? A. High protein. B. High calorie. C. Sodium. D. Potassium. Answer C. Sodium. This question focuses on dietary management for a child with acute glomerulonephritis, especially with signs of fluid overload. Key clues include decreased urine output, elevated blood pressure, and periorbital edema, all pointing to fluid retention and impaired kidney function. Sodium restriction is the most critical dietary intervention because sodium causes water retention, exacerbating edema, hypertension, and fluid overload in a child with compromised kidney function. While protein and potassium may be restricted in severe cases, sodium is the primary concern for fluid balance. When kidneys are struggling, reducing sodium helps prevent fluid from building up. Question 6. A client in the emergency department presents with a severe anaphylactic reaction after being stung by a bee. The client is hypotensive, tachycardic, and experiencing stridor and widespread urticaria. What is the nurse's priority intervention? A. Administering intravenous diphenhydramine. B. Preparing for immediate intubation. C. Administering epinephrine intramuscularly. D. Applying oxygen via a non-rebreather mask. Answer C. Administering epinephrine intramuscularly. This question assesses the immediate management of a life-threatening anaphylactic reaction. The keywords hypotensive, tachycardic, stridor, widespread urticaria indicate a severe systemic reaction with airway compromise and circulatory collapse. Epinephrine is the priority medication because it rapidly reverses bronchospasm, increases blood pressure, and reduces edema and urticaria by acting as a vasoconstrictor and bronchodilator. While oxygen and diphenhydramine are important adjuncts, epinephrine is the definitive life-saving intervention. In an anaphylactic emergency, epinephrine is the fastest way to stabilize the client and protect their airway and circulation. Question 7. A client with a fractured femur is prescribed a cast. 2 hours after cast application, the client reports increasing pain that is unrelieved by opioids, numbness, and tingling in the toes, and the nurse notes pallor and coolness of the toes. What is the nurse's initial action? A. Elevating the affected leg above heart level. B. Administering another dose of opioid analgesic. C. Notifying the healthcare provider immediately. D. Applying ice packs to the cast. Answer C. Notifying the healthcare provider immediately. This question tests the nurse's recognition and immediate response to compartment syndrome, a critical complication. The key clues are increasing pain unrelieved by opioids, numbness and tingling, and pallor and coolness of the toes after cast application. These are classic signs of compartment syndrome, where pressure builds up in the muscle compartment, compromising circulation and nerve function. The initial action is to immediately notify the healthcare provider, as this is a medical emergency requiring prompt intervention, example fasciotomy, to prevent irreversible tissue damage. Elevating the limb or applying ice could worsen the condition, and more pain medication won't address the underlying issue. When signs point to compartment syndrome, rapid communication with the doctor is crucial. Question 8. The nurse is preparing to administer medications to a client with a nasogastric, NG2 connected to low intermittent suction. Which action is essential before administering the medications? A. Crushing all medications into a fine powder. B. Clamping the NG2 for 30-60 minutes after administration. C. Mixing all medications together in one syringe. D. Administering medications through the suction port. Answer B. Clamping the NG2 for 30-60 minutes after administration. This question evaluates the nurse's knowledge of medication administration via an NG tube that is on suction. The critical step before administering medications is to stop the suction and then clamp the NG tube for 30-60 minutes after medication administration. This allows time for the medications to be absorbed and prevents them from being immediately suctioned out, ensuring therapeutic effect. Crushing all medications is often necessary, but not always appropriate for all forms, example enteric-coated, and mixing them together can lead to interactions. Administering through the suction port is incorrect. Medications should go through a medication port or the main lumen. To ensure medications work, keep them in the stomach long enough to be absorbed. Question 9. A client is admitted with a suspected ectopic pregnancy. The client reports sudden, severe, unilateral abdominal pain, shoulder pain, and vaginal spotting. The nurse notes the client is hypotensive and tachycardic. What is the nurse's priority action? A. Administering pain medication as prescribed. B. Preparing the client for immediate surgical intervention. C. Obtaining a detailed menstrual history. D. Monitoring fetal heart tones closely. Answer B. Preparing the client for immediate surgical intervention. This question tests the nurse's ability to recognize and prioritize care for a ruptured ectopic pregnancy, a life-threatening emergency. The keywords sudden, severe, unilateral abdominal pain, shoulder pain, vaginal spotting, hypotensive, and tachycardic are hallmark signs of internal hemorrhage from a ruptured ectopic pregnancy. The priority is to prepare the client for immediate surgical intervention, example laparotomy, to stop the bleeding and remove the ruptured fallopian tube, as this is a medical emergency with a high risk of hypovolemic shock, pain medication, history taking, or fetal monitoring, as there's no viable intrauterine pregnancy, are secondary to stabilizing the client and addressing the life-threatening hemorrhage. In a suspected ruptured ectopic pregnancy, stopping the bleeding through surgery is the absolute priority. Question 10. The nurse is caring for a client with a history of alcohol use disorder who is admitted for detoxification. On the third day of admission, the client becomes agitated, disoriented, tremulous, and experiences visual hallucinations. The client's vital signs are BP 150/98 mg, HR 120 BOPM, or 24 breaths per min, temp 100, 8 degrees Fahrenheit, 38, 2 deg. What is the most appropriate nursing intervention? A. Administering intravenous fluids. B. Initiating seizure precautions. C. Administering a prescribed benzodiazepine. D. Providing a quiet, dark environment. Answer C. Administering a prescribed benzodiazepine. This question tests the nurse's understanding of alcohol withdrawal syndrome, specifically delirium tremens, DTs. The key clues: third day of admission, agitated, disoriented, tremulous, visual hallucinations, and elevated vital signs are classic signs of DTs, a severe and potentially fatal form of withdrawal. The most appropriate and critical nursing intervention is to administer a prescribed benzodiazepine, example, lorazepam, diazepam, as these medications are the first-line treatment to decrease CNS hyperactivity, control symptoms, and prevent seizures. While a quiet environment and seizure precautions are important, medication is the primary treatment for these severe symptoms. When delirium tremens sets in, benzodiazepines are essential to calm the nervous system and prevent complications. Question 11. A nurse is observing a new graduate nurse performing a sterile dressing change for a central venous catheter. Which action by the new graduate nurse requires immediate intervention by the supervising nurse? A. Donning sterile gloves before cleaning the insertion site. B. Using a sterile drape to establish a sterile field. C. Cleaning the insertion site with chlorhexidine in a back and forth motion. D. Allowing the chlorhexidine to air dry completely before applying the new dressing. Answer. A. Donning sterile gloves before cleaning the insertion site. This question evaluates the nurse's understanding of sterile technique during a central line dressing change. The action requiring immediate intervention is donning sterile gloves before cleaning the insertion site. The insertion site must be thoroughly cleaned with an antiseptic solution, like chlorhexidine, before applying sterile gloves, as the cleaning process itself is not sterile and could contaminate the sterile gloves if worn prematurely. Sterile gloves are donned immediately before touching the sterile dressing or the cleaned site. Cleaning technique with chlorhexidine should be back and forth, and air drying is crucial, but these are correct steps performed after the site is prepared. Sterile procedures demand that you clean first, then don sterile gloves to maintain the sterile field. Question 12. The nurse is caring for a client who underwent a thyroidectomy 12 hours ago. The client reports tingling around the mouth and fingertips. Upon assessment, the nurse elicits a positive Chvostek sign. Which medication should the nurse anticipate administering? A. Levothyroxine. B. Calcium gluconate. C. Propylthiouracil, PTU. D. Potassium chloride. Answer. B. Calcium gluconate. This question tests the nurse's knowledge of post-thyroidectomy complications, specifically hypoglycemia. The key clues are tingling around the mouth and fingertips and a positive Chvostek sign, which are classic indicators of hypoglycemia due to accidental removal or damage to the parathyroid glands during surgery. The nurse should anticipate administering calcium gluconate intravenously to rapidly correct the low calcium levels and prevent life-threatening complications like laryngospasm or seizures. Levothyroxine is for hypothyroidism, PTU is for hyperthyroidism, and potassium chloride is for hypokalemia. If calcium levels drop after thyroid surgery, prompt calcium administration is essential to prevent serious complications. Question 13. A client with chronic kidney disease, CKD, is prescribed erythropoietin injections. The client asks the nurse, "Why do I need this medication?" What is the best explanation from the nurse? A. It helps your kidneys remove waste products more efficiently. B. It stimulates your bone marrow to produce more red blood cells. C. It helps control your blood pressure and prevent fluid overload. D. It prevents bone demineralization caused by kidney disease. Answer. B. It stimulates your bone marrow to produce more red blood cells. This question assesses the nurse's understanding of erythropoietin's mechanism of action in clients with CKD. The key concept is that kidneys produce erythropoietin, a hormone essential for red blood cell production. In CKD, damaged kidneys produce insufficient erythropoietin, leading to anemia. Administered erythropoietin stimulates the bone marrow to produce more red blood cells, thereby correcting anemia. It does not directly affect waste removal, blood pressure, or bone health. If your kidneys can't make enough erythropoietin, this medication steps in to boost your red blood cell count. Question 14. The nurse is assessing a client with newly diagnosed ulcerative colitis. Which finding is most characteristic of this condition? A. Skip lesions throughout the gastrointestinal tract. B. Abdominal pain relieved by defecation. C. Bloody diarrhea with pus and mucus. D. Presence of fistulas and strictures. Answer C. Bloody diarrhea with pus and mucus. This question requires differentiation between inflammatory bowel diseases. The keyword ulcerative colitis points to a specific set of symptoms. Bloody diarrhea, often containing pus and mucus, is the hallmark symptom of ulcerative colitis, indicating inflammation and ulceration primarily in the colon and rectum. Skip lesions, fistulas, and strictures are characteristic of Crohn's disease, not ulcerative colitis. While abdominal pain can occur, it's not typically relieved by defecation in ulcerative colitis. Remember, if you see bloody diarrhea with pus and mucus, think ulcerative colitis. Question 15. A client who experienced a traumatic brain injury, TBI, exhibits decerebrate posturing. The nurse understands that this finding indicates damage to which area of the brain? A. Cerebral cortex. B. Midbrain or brainstem. C. Cerebellum. D. Basal ganglia. Answer B. Midbrain or brainstem. This question tests the nurse's understanding of neurological assessment findings and their anatomical significance. Decerebrate posturing, characterized by rigid extension of the arms and legs, pronation of the arms, and plantar flexion, indicates severe damage to the brainstem or midbrain. This is a more serious indicator than decorticate posturing, which suggests damage to the cerebral hemispheres or internal capsule. Understanding these postures helps pinpoint the level of neurological injury. When a client shows decerebrate posturing, it's a critical sign of severe damage low in the brain, like the midbrain or brainstem. Question 16. A client receiving chemotherapy reports severe nausea and vomiting despite prophylactic antiemetics. The client is becoming dehydrated. What is the nurse's priority action? A. Administering a different antiemetic agent. B. Encouraging the client to eat small, frequent meals. C. Notifying the healthcare provider of the intractable nausea and vomiting. D. Administering intravenous fluids to correct dehydration. Answer C. Notifying the healthcare provider of the intractable nausea and vomiting. This question assesses prioritization for a client experiencing intractable nausea and vomiting during chemotherapy. The key clues are severe nausea and vomiting despite prophylactic antiemetics, and becoming dehydrated, indicating the current management plan is ineffective and leading to a complication. The priority is to notify the healthcare provider, as they can order stronger or different antiemetic regimens, adjust chemotherapy, or initiate alternative strategies to manage this persistent symptom and prevent further complications like electrolyte imbalances or malnutrition. While IV fluids are important, they are a supportive measure, and finding a solution for the nausea is the primary concern. If antiemetics aren't working, tell the doctor immediately so they can adjust the plan. Question 17. The nurse is educating a client recently diagnosed with celiac disease about dietary management. Which food item should the nurse instruct the client to strictly avoid? A. Rice. B. Corn. C. Oats. D. Barley. Answer D. Barley. This question tests the nurse's knowledge of dietary restrictions for celiac disease. Celiac disease is an autoimmune disorder triggered by gluten, a protein found in wheat, barley, and rye. Therefore, barley must be strictly avoided. While pure oats are generally considered safe for most individuals with celiac disease, cross-contamination is a concern, so certified gluten-free oats are recommended. Rice and corn are naturally gluten-free. For clients with celiac disease, remember the BROW acronym for foods to avoid. Barley, rye, oats, unless certified gluten-free. Wheat. Question 18. A 2-year-old child is admitted with epiglottitis. The nurse observes the child sitting in a tripod position, drooling, and experiencing inspiratory stridor. What is the nurse's priority action? A. Obtaining a throat culture to identify the causative organism. B. Assessing the child's vital signs and oxygen saturation. C. Preparing for immediate intubation or tracheostomy. D. Administering humidified oxygen via mask. Answer: C. Preparing for immediate intubation or tracheostomy. This question assesses the nurse's understanding of the critical and rapidly progressing nature of epiglottitis in a child. The key clues are tripod position, drooling, and inspiratory stridor, which are classic signs of severe airway obstruction. Epiglottitis is a medical emergency that can lead to complete airway occlusion. The priority is to prepare for immediate intubation or tracheostomy, as this is the definitive way to secure the airway. Any action that could irritate the airway, such as a throat culture or even attempting to visualize the throat, should be avoided. While oxygen and vital sign monitoring are important, securing the airway is paramount. In a child with suspected epiglottitis, protect the airway first and foremost. Avoid anything that could worsen swelling. Question 19. A client is receiving a blood transfusion and develops sudden shortness of breath, chills, and lower back pain. The nurse notes dark urine in the Foley catheter bag. What is the nurse's immediate action? A. Slowing down the transfusion rate. B. Administering an antihistamine. C. Stopping the transfusion immediately. D. Elevating the client's head of the bed. Answer: C. Stopping the transfusion immediately. This question describes a classic acute hemolytic transfusion reaction, a life-threatening emergency. The key clues are shortness of breath, chills, lower back pain, and dark urine, which indicate red blood cell destruction. The nurse's absolute immediate action is to stop the transfusion immediately to prevent further reaction and harm. After stopping, maintain IV access with a new tubing and normal saline. Notify the blood bank and healthcare provider, and monitor the client. While other actions might be part of the subsequent management, stopping the incompatible blood infusion is the crucial first step. If a client has symptoms of a blood transfusion reaction, the very first thing you do is stop that transfusion. Question 20. The nurse is caring for a client with a new colostomy. The client is reluctant to look at the stoma and expresses disgust. What is the most appropriate nursing response? A. You'll get used to it. Many people live normal lives with a colostomy. B. It's important to learn how to care for your stoma so you can go home. C. It sounds like you're having a hard time adjusting. What concerns you most? D. Let me show you how to change the pouch. It's easier than you think. Answer: C. It sounds like you're having a hard time adjusting. What concerns you most? This question tests the nurse's therapeutic communication skills and ability to address a client's psychosocial adaptation to a new body image. The client's reluctance and disgust indicate a need for emotional support and assessment of their feelings. A therapeutic response acknowledges their difficulty. It sounds like you're having a hard time adjusting, and then invites them to express their specific concerns. What concerns you most? Opening a dialogue for further assessment and intervention. The other options are dismissive, focus on tasks prematurely, or offer false reassurance without addressing the client's emotional state. When a client expresses distress about their body, validate their feelings and invite them to share more. Question 21. A client with a traumatic spinal cord injury at the T6 level develops a pounding headache, profuse sweating above the injury, and nasal congestion. The nurse notes a blood pressure of 180/100 mmHg. What is the nurse's priority action? A. Administering a prescribed antihypertensive medication. B. Checking the client's bladder for distension. C. Elevating the head of the bed to 90 degrees. D. Applying a cold compress to the client's forehead. Answer: B. Checking the client's bladder for distension. This question describes classic signs of autonomic dysreflexia, a life-threatening emergency in clients with spinal cord injuries at T6 or above. The key clues are pounding headache, profuse sweating above the injury, nasal congestion, and blood pressure of 180/100 mmHg. Autonomic dysreflexia is triggered by noxious stimuli below the level of injury, most commonly a full bladder or bowel impaction. The priority action is to identify and remove the stimulus, such as checking for bladder distension and catheterizing if needed, or checking for bowel impaction, while elevating the head of the bed to reduce blood pressure and administering antihypertensives might be part of management. Addressing the cause is primary. When autonomic dysreflexia occurs, find and remove the irritating stimulus below the injury site. Question 22. The nurse is providing discharge teaching for a client with diverticulosis. Which dietary instruction is most important to emphasize to prevent complications? A. Avoid nuts, seeds, and popcorn. B. Increase intake of insoluble fiber. C. Limit fluid intake to prevent diarrhea. D. Follow a low-residue diet indefinitely. Answer. B. Increase intake of insoluble fiber. This question tests knowledge of dietary management for diverticulosis. The main goal in diverticulosis is to prevent the formation of diverticulitis, inflammation or infection of the pouches. A diet high in insoluble fiber, like whole grains, fruits with skins, and vegetables, is crucial as it adds bulk to the stool, promoting regular bowel movements and reducing pressure within the colon, thus preventing diverticula from becoming inflamed. While nuts, seeds, and popcorn were once advised against, current evidence generally does not support their avoidance. Limiting fluid intake is incorrect, and a low-residue diet is for acute diverticulitis, not for prevention in diverticulosis. To prevent diverticulitis, eat more fiber, especially insoluble fiber. Question 23. A client with a history of alcohol use disorder is admitted with acute pancreatitis. The nurse anticipates administering which medication to manage the primary symptom of this condition? A. Insulin. B. Pancreatic enzymes. C. Opioid analgesics. D. Antacids. Answer. C. Opioid analgesics. This question focuses on the acute management of pancreatitis. The primary symptom of acute pancreatitis is severe, unrelenting abdominal pain, which requires potent pain management. Opioid analgesics are typically the medication of choice to relieve this severe pain. Insulin might be needed if hyperglycemia develops. Pancreatic enzymes are for chronic pancreatitis or malabsorption, and antacids are for acid reflux, none of which address the acute, severe pain. When a client has acute pancreatitis, managing their severe pain with opioids is a top priority. Question 24. The nurse is caring for a client with a large full-thickness burn on the leg. The nurse notes decreased peripheral pulses distal to the burn, and the client reports increasing pain despite analgesia. The burn is circumferential. What is the nurse's priority action? A. Administering a higher dose of pain medication. B. Elevating the burned extremity. C. Preparing for an escharotomy. D. Applying warm compresses to the limb. Answer. C. Preparing for an escharotomy. This question describes the signs of compartment syndrome secondary to a circumferential full-thickness burn. The key clues are decreased peripheral pulses, increasing pain despite analgesia, and a circumferential burn. Full-thickness circumferential burns can cause a tourniquet-like effect as the eschar, burned tissue, hardens, leading to compromised circulation and potential tissue necrosis. The priority action is to prepare for an escharotomy, a surgical incision through the eschar to relieve pressure and restore circulation. Elevating the extremity might worsen the pressure, and more pain medication won't solve the underlying circulatory problem. If a circumferential burn restricts circulation, an escharotomy is needed to save the limb. Question 25. The nurse is teaching a client with newly diagnosed glaucoma about medication administration. Which statement by the client indicates a need for further teaching? A. I should apply gentle pressure to the inner corner of my eye after putting in the drops. B. I will instill one drop into my eye and then close my eye immediately. C. I need to take my eye drops every day, even if my vision seems fine. D. I will wait 5 minutes between different types of eye drops if I have more than one. Answer: B. I will instill one drop into my eye and then close my eye immediately. This question assesses proper eye drop administration techniques for a client with glaucoma. The statement, I will instill one drop into my eye and then close my eye immediately, indicates a need for further teaching. After instilling eye drops, the client should gently close the eye and apply gentle pressure to the nasolacrimal duct, inner corner of the eye, for 30-60 seconds to prevent systemic absorption and increase local absorption. Immediately closing the eye without pressure might allow the medication to drain too quickly. All other options are correct techniques for eye drop administration. To make sure glaucoma eye drops work, close your eye gently and apply pressure to the inner corner for a short time. Question 26. A client in the intensive care unit has a central venous pressure, CVP, reading of 2 mmHg. The nurse also notes decreased urine output, dry mucous membranes, and flattened neck veins. Which intervention should the nurse anticipate? A. Administering a diuretic. B. Increasing intravenous fluid infusion rate. C. Preparing for a paracentesis. D. Administering a vasoconstrictor. Answer: B. Increasing intravenous fluid infusion rate. This question tests the nurse's ability to interpret CVP readings and associated clinical signs of fluid status. A CVP of 2 mmHg, normal to 6 mmHg, along with decreased urine output, dry mucous membranes, and flattened neck veins, indicates hypovolemia or fluid deficit. The nurse should anticipate increasing the intravenous fluid infusion rate to restore fluid volume and normalize CVP. Diuretics would worsen hypovolemia. Paracentesis is for ascites, and vasoconstrictors are used for severe hypotension or shock, not primary hypovolemia. A low CVP plus signs of dehydration means the client needs more fluids. Question 27. The nurse is conducting discharge teaching for a client with chronic obstructive pulmonary disease, COPD. Which statement by the client indicates a need for further teaching regarding oxygen therapy at home? A. I will use my oxygen at 2 liters per minute as prescribed. B. I should avoid using petroleum jelly around my nose while on oxygen. C. It's okay to smoke a cigarette if I turn off my oxygen first. D. I will ensure my oxygen tank is stored upright and away from heat. Answer: C. It's okay to smoke a cigarette if I turn off my oxygen first. This question assesses the client's understanding of oxygen safety, especially relevant for clients with COPD. The statement, "It's okay to smoke a cigarette if I turn off my oxygen first," indicates a critical misunderstanding and a significant safety risk. Oxygen is highly flammable, and even residual oxygen in clothing or the immediate environment can ignite, leading to severe burns or explosions. Smoking is absolutely prohibited while oxygen is in use or even in the same room. All other statements are correct safety guidelines. Never, ever smoke near oxygen, even if it's turned off, because it's still a fire hazard. Question 28. A client is admitted to the emergency department after a motor vehicle accident. The client is unconscious, has a GCS score of 7, and a dilated and fixed pupil on the right side. What is the nurse's priority concern? A. Spinal cord injury. B. Increased intracranial pressure, ICP. C. Internal abdominal bleeding. D. Fractured extremities. Answer: B. Increased intracranial pressure, ICP. This question assesses the nurse's ability to recognize immediate life-threatening complications following head trauma. The key clues are unconscious, GCS score of 7, indicating severe impairment, and a dilated and fixed pupil on the right side. A unilateral dilated and fixed pupil, especially with decreasing consciousness, is a classic and critical sign of uncol herniation, often caused by rapidly increasing intracranial pressure, ICP, compressing the oculomotor nerve, CNIY. This is a neurological emergency requiring immediate intervention. While other injuries are possible, ICP is the most immediate threat to life and neurological function in this scenario. A fixed and dilated pupil in an unconscious trauma client signals a severe brain emergency, like increased ICP. Question 29. The nurse is preparing to administer phenytoin intravenously to a client with a seizure disorder. Which action is most important to ensure safe administration? A. Administering the medication rapidly over 1 minute. B. Mixing phenytoin with dextrose 5% in water, D5W. C. Monitoring for hypotension and cardiac arrhythmias during administration. D. Discontinuing all other anticonvulsant medications before administration. Answer C. Monitoring for hypotension and cardiac arrhythmias during administration. This question tests safe intravenous administration of phenytoin, a medication known for potential cardiac side effects. Phenytoin should be administered slowly, typically no faster than 50 milligrams per min, and diluted only with normal saline, not D5W, due to precipitation. The most important safety action is to closely monitor for hypotension and cardiac arrhythmias, especially bradycardia or heart block, during administration, as rapid infusion or sensitivity to the medication can cause these severe cardiovascular effects. Discontinuing other anticonvulsants is generally not indicated. When giving IV phenytoin, watch the client's heart rate and blood pressure very carefully. Question 30. A client with Addison's disease is admitted in adrenal crisis. The nurse anticipates administering which medication immediately? A. Oral prednisone. B. Intravenous hydrocortisone. C. Spironolactone. D. Desmopressin. Answer B. Intravenous hydrocortisone. This question focuses on the emergency management of an adrenal crisis. Adrenal crisis is a life-threatening condition caused by acute adrenal insufficiency, requiring immediate replacement of corticosteroids. The priority medication is intravenous hydrocortisone, a glucocorticoid, as it rapidly replaces the deficient hormones and addresses the circulatory collapse and electrolyte imbalances seen in crisis. Oral prednisone is for long-term maintenance, spironolactone is a potassium-sparing diuretic, and desmopressin is for diabetes insipidus. In an adrenal crisis, rapid IV administration of corticosteroids is crucial to save the client's life. Question 31. The nurse is caring for a newborn diagnosed with tetralogy of Fallot. The infant suddenly becomes cyanotic, restless, and develops hyperpnea during a feeding. What is the nurse's priority action? A. Administering a prescribed diuretic. B. Placing the infant in a knee-chest position. C. Preparing for immediate cardiac catheterization. D. Encouraging the mother to continue feeding slowly. Answer B. Placing the infant in a knee-chest position. This question describes a TET spell or hypercyanotic spell, a critical and life-threatening event in infants with tetralogy of Fallot. The key clues are cyanotic, restless, hyperpnea during a feeding. The priority intervention is to place the infant in a knee-chest position. This position increases systemic vascular resistance, which in turn reduces the right to left shunting of deoxygenated blood through the ventricular septal defect, allowing more blood to flow to the lungs and improving oxygenation. Diuretics are not indicated for a TET spell, and cardiac catheterization is a diagnostic or interventional procedure, not an immediate crisis management tool. During a TET spell, the knee-chest position helps the infant get more oxygen. Question 32. The nurse is educating a client with a new prescription for warfarin. Which food should the nurse instruct the client to consume in consistent, moderate amounts rather than avoiding entirely? A. Grapefruit juice. B. Cranberry products. C. Green leafy vegetables. D. Alcohol. Answer C. Green leafy vegetables. This question tests knowledge about dietary interactions with warfarin, an anticoagulant. Warfarin works by antagonizing vitamin K, which is abundant in green leafy vegetables, example spinach, kale, broccoli. The instruction is not to avoid these foods entirely, but to consume them in consistent, moderate amounts. Significant fluctuations in vitamin K intake can alter the effectiveness of warfarin, leading to subtherapeutic or supratherapeutic anticoagulation. Grapefruit juice and cranberry products can enhance warfarin's effect and should be avoided or consumed cautiously, while alcohol should be limited due to bleeding risk. When on warfarin, consistency is key with foods high in vitamin K. Question 33. A client with a long history of peptic ulcer disease reports sudden, severe abdominal pain, a rigid, board-like abdomen, and absent bowel sounds. What is the nurse's priority action? A. Administering antacids as prescribed. B. Preparing the client for emergency surgery. C. Inserting a nasogastric tube to suction. D. Obtaining a comprehensive pain assessment. Answer B. Preparing the client for emergency surgery. This question describes the classic signs of a perforated peptic ulcer, a life-threatening surgical emergency. The key clues are sudden, severe abdominal pain, rigid, board-like abdomen, and absent bowel sounds. These findings indicate peritonitis caused by leakage of gastric contents into the abdominal cavity. The priority is to prepare the client for immediate emergency surgery, laparotomy, to repair the perforation. While NGT insertion and pain assessment might be part of the pre-op care, the definitive action is surgical intervention. A rigid, board-like abdomen with sudden severe pain is a surgical emergency. Prepare the client for the operating room. Question 34. The nurse is monitoring a client with diabetic ketoacidosis, TK, which arterial blood gas, ABG, result would the nurse expect to find? A. 750 PaTO 230 mg, HCO 324 mg per L. B. 720 PaTO 230 mg, HCO 315 mg per L. C. 745 PaTO 240 mg, HCO 328 mg per L. D. 735 PaTO 245 mg, HCO 322 mg per L. Answer B. 720 PaTO 230 mg, HCO 315 mg per L. This question tests the nurse's understanding of ABG interpretation in diabetic ketoacidosis, TK. DKA is characterized by metabolic acidosis, meaning the feed will be low, acidic, and the bicarbonate, HCO3, will be low. The body attempts to compensate by hyperventilating, cosmal respirations, which blows off CO2, resulting in a low PaCO2. Therefore, pH 720, acidic, PaTO 230 mg, low, indicating respiratory compensation, and HCO 315 mg per L, low, indicating metabolic acidosis, are consistent with DKA. In DKA, expect low pH and low bicarbonate, with the body trying to compensate by breathing faster and deeper, leading to a low TO2. Question 35. A client with a severe exacerbation of asthma is admitted to the emergency department. The client is dyspneic, wheezing, and has a respiratory rate of 30 breaths per min. The client's peak expiratory flow rate, PEFR, is 40% of their personal best. Which medication should the nurse anticipate administering first? A. Inhaled corticosteroids. B. Long-acting beta-agonists. C. Short-acting beta-agonists, SABAs. D. Oral prednisone. Answer: C. Short-acting beta-agonists, SABAs. This question assesses the priority medication for an acute asthma exacerbation. The key clues are severe exacerbation, dyspneic, wheezing, and a very low PEFR of 40%. In an acute asthma attack, the priority is to rapidly bronchodilate to open the airways. Short-acting beta-agonists, SABAs, such as albuterol, are the first-line treatment due to their rapid onset of action and effectiveness in relaxing bronchial smooth muscles. Inhaled corticosteroids and long-acting beta-agonists are for maintenance therapy, and oral prednisone is for moderate to severe exacerbations, but has a slower onset than SABAs. For an acute asthma attack, reach for the fast-acting rescue inhaler first. Question 36. The nurse is caring for a client with a history of intravenous drug use who is admitted with infective endocarditis. The client suddenly reports sharp, pleuritic chest pain and dyspnea. The nurse observes cyanosis and notes a new harsh murmur. What complication should the nurse suspect? A. Myocardial infarction. B. Pulmonary embolism. C. Aortic aneurysm rupture. D. Pericarditis. Answer: B. Pulmonary embolism. This question tests the nurse's ability to recognize complications of infective endocarditis, particularly in the context of IV drug use. Right-sided endocarditis, common in IV drug users affecting the tricuspid valve, can lead to septic emboli dislodging and traveling to the lungs. The key clues are sharp pleuritic chest pain, dyspnea, and cyanosis in a client with infective endocarditis, which are classic signs of a pulmonary embolism. While a new murmur is present, the respiratory symptoms point strongly to a pulmonary event. Myocardial infarction typically presents differently, and aortic aneurysm rupture or pericarditis do not fit the constellation of symptoms. If an IV drug user with endocarditis suddenly gets chest pain and shortness of breath, suspect a blood clot has traveled to the lungs. Question 37. A client is prescribed vancomycin intravenously. Before administering the dose, the nurse notes the client's serum creatinine is 5 mg per dl, normal 6.1, 2 mg per dl, and the client has ringing in their ears. What is the most appropriate nursing action? A. Administer the vancomycin as prescribed. B. Administer the vancomycin at a slower infusion rate. C. Hold the vancomycin dose and notify the healthcare provider. D. Request a peak and trough level of vancomycin. Answer: C. Hold the vancomycin dose and notify the healthcare provider. This question tests the nurse's understanding of nephrotoxicity and ototoxicity associated with vancomycin. The key clues are serum creatinine 5 mg per dl, indicating impaired kidney function, and ringing in their ears, tinnitus, a sign of ototoxicity. Both are adverse effects of vancomycin, and impaired renal function increases the risk of toxicity because the drug is primarily renally excreted. Therefore, the most appropriate action is to hold the dose and immediately notify the healthcare provider. This allows for reassessment of kidney function, potential dosage adjustment, or switching to another antibiotic to prevent further organ damage. If a client on vancomycin shows signs of kidney trouble or ringing in their ears, stop the drug and call the doctor right away. Question 38. The nurse is assessing a 6-month-old infant brought to the emergency department by parents who report the infant has been irritable, refusing to feed, and crying with leg flexion towards the abdomen. A current jelly stool is noted in the diaper. What condition should the nurse suspect? A. Pyloric stenosis. B. Appendicitis. C. Intussusception. D. Gastroenteritis. Answer: C. Intussusception. This question describes classic signs of intussusception, a common cause of intestinal obstruction in infants. The key clues are 6-month-old infant, irritable, refusing to feed, crying with leg flexion towards the abdomen. indicating colicky abdominal pain, and especially the pathognomonic current jelly stool, blood, and mucus. Pyloric stenosis presents with projectile vomiting. Appendicitis is less common and presents differently in infants, and gastroenteritis typically causes watery diarrhea. Recognizing current jelly stool in an infant with colicky pain should immediately make you suspect intussusception. Question 39. The nurse is caring for a client with a history of atrial fibrillation who is experiencing new onset shortness of breath, frothy pink sputum, and crackles throughout all lung fields. The nurse notes the client's pulse is rapid and irregular. What is the nurse's priority intervention? A. Administering a prescribed beta blocker. B. Preparing for immediate synchronized cardioversion. C. Elevating the head of the bed and applying oxygen. D. Administering a prescribed anticoagulant. Answer: C. Elevating the head of the bed and applying oxygen. This question describes acute pulmonary edema, likely exacerbated by uncontrolled atrial fibrillation, leading to left ventricular dysfunction. The key clues are shortness of breath, frothy pink sputum, crackles throughout all lung fields, and a rapid and irregular pulse. While managing the atrial fibrillation is important, the immediate life-threatening issue is respiratory compromise due to fluid in the lungs. The priority intervention is to elevate the head of the bed and apply high-flow oxygen to improve gas exchange and reduce venous return, thus alleviating pulmonary congestion. Once stabilized, medications like diuretics or rhythm control may be initiated. In acute respiratory distress from fluid overload, getting the client upright and giving oxygen takes precedence. Question 40. A client with a new permanent pacemaker insertion is being discharged. Which statement by the client indicates a need for further teaching? A. I need to avoid lifting my arm on the pacemaker side above my shoulder for a few weeks. B. I should keep a record of my pulse rate and report any sudden changes. C. It's safe for me to use my microwave oven and electric blanket. D. I will not be able to use my cell phone anymore because of the pacemaker. Answer: D. I will not be able to use my cell phone anymore because of the pacemaker. This question assesses the client's understanding of pacemaker precautions. The statement, I will not be able to use my cell phone anymore because of the pacemaker, indicates a need for further teaching. Clients with pacemakers can generally use cell phones, but they should hold the phone to the ear opposite the pacemaker site and avoid carrying it in a shirt pocket directly over the pacemaker. All other statements are correct discharge instructions for a new pacemaker, aimed at preventing dislodgement of leads and monitoring function. Modern pacemakers are largely resistant to common electromagnetic interference, so normal cell phone use is generally fine with minor precautions. Question 41. The nurse is providing care for a client in skeletal traction. The client reports severe pain in the affected leg that is unrelieved by pain medication. The nurse notes pallor, coolness, and diminished pulses distal to the injury. What is the nurse's priority action? A. Reassessing the client's pain level in 30 minutes. B. Loosening the traction weights slightly. C. Notifying the healthcare provider immediately. D. Repositioning the client for comfort. Answer: C. Notifying the healthcare provider immediately. This question describes the classic signs of compartment syndrome in a limb with skeletal traction. The key clues are severe pain unrelieved by pain medication, pallor, coolness, and diminished pulses distal to the injury. These are emergent signs of compromised circulation and nerve function within a muscle compartment, which can lead to irreversible tissue damage. The priority is to immediately notify the healthcare provider, as this is a surgical emergency requiring rapid intervention, example fasciotomy. Loosening weights or repositioning does not address the underlying pressure buildup. When compartment syndrome is suspected, rapid communication with the doctor is vital. Question 42. A client with active tuberculosis, TB, is being discharged home. Which instruction is most important for the nurse to include in the discharge teaching? A. You will need to be on strict bed rest for the next 2 weeks. B. You can stop taking your medications once your symptoms improve. C. You should wear a mask in crowded public places for the next month. D. It is crucial to complete the entire course of medication therapy, even if you feel better. Answer: D. It is crucial to complete the entire course of medication therapy, even if you feel better. This question focuses on preventing drug resistance and relapse in clients with tuberculosis. The most important instruction for a client with active TB is to complete the entire prescribed course of multi-drug therapy, which can last for 6-9 months or even longer. Non-adherence and premature discontinuation of medications are the primary causes of drug-resistant TB, which is much harder to treat. Symptoms may improve quickly, but the bacteria can still be present and active if medication is stopped too soon. Wearing a mask in public is important initially, but completing medication is key for cure and preventing resistance. The most important thing about TB medication is to take every single dose for as long as prescribed, even after you feel better. Question 43. The nurse is caring for a client with a history of alcohol use disorder admitted with ascites and hepatic encephalopathy. The client is confused, drowsy, and has asterixis. Which dietary modification is most appropriate for this client? A. High protein, high calorie. B. Low sodium, moderate protein. C. Low protein, high carbohydrate. D. High potassium, low fat. Answer: C. Low protein, high carbohydrate. This question tests the nurse's knowledge of dietary management for hepatic encephalopathy due to liver cirrhosis. Hepatic encephalopathy is caused by the liver's inability to metabolize ammonia, which is a byproduct of protein breakdown. Therefore, a low-protein diet is crucial to reduce ammonia production and improve neurological symptoms like confusion, drowsiness, and asterixis. A high carbohydrate intake provides energy. Sodium restriction is important for ascites, but protein restriction is paramount for encephalopathy. In clients with hepatic encephalopathy, limiting protein intake helps reduce ammonia levels in the brain. Question 44. A client is receiving magnesium sulfate infusion for preeclampsia with severe features. The nurse assesses the client and notes a respiratory rate of 10 breaths per min and absent deep tendon reflexes. What is the nurse's priority action? A. Increasing the magnesium sulfate infusion rate. B. Notifying the healthcare provider immediately. C. Administering a prescribed antihypertensive medication. D. Preparing to administer calcium gluconate. Answer: D. Preparing to administer calcium gluconate. This question describes signs of magnesium sulfate toxicity, a life-threatening complication. The key clues are respiratory rate of 10 breaths per min, indicating central nervous system depression, and absent deep tendon reflexes. These are classic signs of magnesium toxicity. The priority action is to prepare to administer calcium gluconate, which is the antidote to magnesium toxicity and can reverse its effects, especially respiratory depression. While notifying the healthcare provider is essential, preparing the antidote is the immediate life-saving measure. Never increase the infusion or administer an antihypertensive for toxicity. If a client on magnesium sulfate shows signs of toxicity, get the calcium gluconate ready. It's the antidote. Question 45. The nurse is assessing a client with a suspected ruptured cerebral aneurysm. Which clinical manifestation would the nurse most likely find? A. Gradual onset of unilateral weakness. B. Sudden, severe headache described as the worst headache of my life. C. Visual disturbances with flashing lights and auras. D. Bradycardia and bradypnea. Answer: B. Sudden, severe headache described as the worst headache of my life. This question describes the classic presentation of a ruptured cerebral aneurysm, which causes a subarachnoid hemorrhage. The hallmark symptom is a sudden, severe headache, often described as the worst headache of my life. This is due to blood irritating the meninges. Gradual unilateral weakness suggests ischemic stroke. Visual disturbances with aura are common in migraines, and bradycardia bradypnea are signs of Cushing's triad. Increased ICP, which can occur but are not the initial, most defining symptom of a ruptured aneurysm itself. When a client reports the worst headache of their life, always consider a ruptured cerebral aneurysm. Question 46. The nurse is caring for a client with a new permanent ileostomy. The client expresses concern about odor from the stoma. Which dietary instruction is most appropriate for the nurse to provide? A. Avoid all spicy foods and dairy products. B. Increase your intake of high-fiber foods to regulate bowel movements. C. Consume foods like parsley, yogurt, and buttermilk to help control odor. D. Limit your fluid intake to make the stool thicker and less odorous. Answer: C. Consume foods like parsley, yogurt, and buttermilk to help control odor. This question addresses common concerns of clients with new ileostomies, specifically regarding odor management. Certain foods can help reduce or produce odor. Foods like parsley, yogurt, and buttermilk are known to have odor-reducing properties for ostomy output. Avoiding all spicy foods and dairy is too restrictive and not universally necessary. Increasing high-fiber foods can be challenging with an ileostomy due to the risk of obstruction, and limiting fluid intake is incorrect as it can lead to dehydration and thicker, harder-to-manage output. To help manage odor from an ileostomy, suggest foods like parsley, yogurt, or buttermilk. Question 47. A client with cirrhosis and esophageal varices has a Sengstaken-Blakemore tube in place. The nurse notes the client is experiencing respiratory distress. What is the nurse's priority action? A. Deflating the gastric balloon first. B. Notifying the healthcare provider immediately. C. Cutting the balloon ports and removing the tube. D. Administering a prescribed anxiolytic. Answer: C. Cutting the balloon ports and removing the tube. This question addresses an emergent complication of a Sengstaken-Blakemore tube. The key clue, respiratory distress, in a client with this tube is a critical red flag, as it indicates potential displacement of the esophageal balloon upwards, occluding the airway. The priority, life-saving action is to immediately cut the balloon ports, usually with scissors kept at the bedside for this purpose, and remove the tube to relieve airway obstruction. Deflating only the gastric balloon first will not resolve the airway issue, and notifying the healthcare provider delays crucial intervention. In an emergency with a Sengstaken-Blakemore tube and respiratory distress, immediately cut the balloon ports to free the airway. Question 48. The nurse is preparing to administer packed red blood cells, PRBCs, to a client. Which intravenous solution is compatible with PRBCs and should be used to prime the tubing? A. Dextrose 5% in water, D5W. B. Lactated Ringer's solution. C. 0.9% sodium chloride. Normal saline. D. Dextrose 5% in 0.45% sodium chloride. Answer: C. 0.9% sodium chloride. Normal saline. This question tests essential knowledge about blood product administration. 0.9% sodium chloride. Normal saline is the only solution compatible with packed red blood cells for infusion or priming the tubing. Other solutions, such as D5W or lactated Ringer's, can cause hemolysis, destruction of red blood cells, or clotting, rendering the transfusion unsafe and ineffective. Always remember, when giving blood, normal saline is the only safe solution to use with it. Question 49. A client with a head injury begins to exhibit signs of diabetes insipidus, including excessive urine output and profound thirst. The nurse anticipates administering which medication? A. Furosemide, the desmopressin, DDAVP. C. Hydrochlorothiazide. D. Spironolactone. Answer B. Desmopressin, DDAVP. This question assesses the management of diabetes insipidus, DI, a common complication of head injury impacting the posterior pituitary. The key clues are excessive urine output and profound thirst, which are classic signs of DI, indicating a deficiency of antidiuretic hormone, ADH. The nurse anticipates administering desmopressin, DDAVP, which is a synthetic analog of ADH, to reduce urine output and control symptoms. Furosemide, hydrochlorothiazide, and spironolactone are diuretics that would worsen DI by increasing urine output. If a client with a head injury starts producing a lot of urine and is very thirsty, they likely have diabetes insipidus and will need desmopressin. Question 50. The nurse is caring for a client with a chest tube following a lobectomy. The nurse notes continuous bubbling in the water seal chamber. What is the nurse's priority action? A. Documenting the finding and continuing to monitor. B. Increasing the suction to the chest tube drainage system. C. Clamping the chest tube to assess for air leak location. D. Assessing the chest tube system for a leak. Answer D. Assessing the chest tube system for a leak. This question tests the nurse's response to an air leak in a chest tube system. Continuous bubbling in the water seal chamber, especially after initial insertion, indicates an air leak within the system, from the client, the tubing, or the collection device. The priority action is to systematically assess the chest tube system, starting from the insertion site, to identify and locate the source of the air leak. Documenting is insufficient. Increasing suction won't fix the leak, and clamping the chest tube without a specific order or for a brief moment to quickly locate a leak could lead to tension pneumothorax if an active air leak from the lung continues. When you see continuous bubbling in the water seal chamber, your immediate task is to find out where the air leak is coming from.